Assalamu alaikum, everyone. Just going to start now. First of all, Jazakallah for everyone that's attending today and everyone that's watching on the live feed. I've done a few sessions here so far with different conditions. Today we're going to be talking about shoulder and shoulder injuries. If you don't know who I am, my name is Dr. Fawad Malik. I'm a chiropractor at Achieve Physio and Rehab. We're just close to Winston Churchill and 403 area, so there's a rehab clinic there. We have chiropractors, physios, massage therapists, just specifically focusing on injuries. So today we're going to talk about shoulders. So in terms of shoulder joint, the shoulder joint is a very unique and dynamic joint. What I mean by that is, like, for example, with the knee joint, you only have two movements. You can either bend the knee in or you can straighten it out. Whereas with the shoulder, you have a global range of movements. You can move it in any direction. You can go up, down, sideways, backwards, in, out, rotate. Whatever you want to do, you can do it with the shoulder. So they call it a dynamic shoulder joint. And with that comes a lot of muscles that are working together to achieve these movements, because your bones only move with activation of their muscles. So for example, just on your shoulder blade, you have about 17 muscles attached to it. So, when we have shoulder injuries, typically they're very complex injuries, because once you have an injury to a certain area, certain muscles get weak, other muscles start overworking, so they get really tight. So if you can imagine 17 to 20 muscles attached to the shoulder joint itself, if certain muscles get weak and other ones are overworking and are getting tight, they're pulling it in a different direction, then your shoulder starts to go into the wrong position. So it gets into an abnormal position. So that's why it becomes a very complex injury to treat. So we'll talk about some of the common injuries that happen with shoulder joints, and then I'll kind of give you guys some tips on how to avoid injuries. Especially with the shoulder, and some exercises that you guys can work on to maintain movement in the shoulder and to prevent injuries. Now, in the past year, I'd say I'm starting to see a lot more shoulder injuries, and there's a reason for that, and it's because of the posture. A lot of people are working from home now. They don't have very good workstations since COVID, and their posture is starting to drop. And with that causes a lot of shoulder issues. So I'll explain some of that at the end. In terms of shoulder injuries, so we'll go through some of the common injuries. One of the most common injuries that I'm sure a lot of you have heard of are rotator cuff, either a tear or a strain. So basically what that is you have four muscles that basically start from the back of your shoulder blade, and they come and attach to the actual bone. The four muscles are your supra, your infra, teres, and your subscap. Those four muscles that are kind of starting from back here, and they come and attach here, they basically wrap around this bone. Their main purpose is to keep this bone in its position. With a lot of repetitive work, repetitive lifting, some people have a lot of lifting jobs, some people do a lot of overhead stuff, that tends to cause some strain in those muscles. So when they say you have a rotator cuff strain, they're basically saying one of your muscles is either stretched, irritated, or possibly torn. Generally speaking, it's tested to see how your muscles are, when we're checking to see if you have a rotator cuff strain, we test to see if certain muscles are weak, they're not performing. If your arm is dropping, that can tell us that you possibly have a rotator cuff strain. Typically when we see patients like that, we start some physio, some rehab with them. Generally the pain starts to reduce after a few weeks, but sometimes it persists. And at that point, we usually tell patients to go see your family doctor and maybe get an ultrasound done. And sometimes it shows that there's a tear there. So the tears tend to take a little longer to heal. So if you have a rotator cuff tear, you're possibly looking at anywhere between 8 to 12 weeks of healing, and then at least another 3 months of strengthening, because anytime you injure a muscle, it gets weak very quickly, and then the rehab for strengthening takes a really long time. So we'll go through some strengthening exercises today too, so hopefully I can kind of help you guys with that. Another common injury with shoulders is a shoulder impingement. You might hear that sometimes. So what that is talking about is in your, let me see if I can touch this. Sometimes you have a bone right up here. It's your AC bone, and then you have a couple rotator cuff muscles that go right under it, as well as your biceps muscle. What happens sometimes is that muscle in between this bone and your arm bone, they get pinched. When they get pinched, they call that a shoulder impingement. With shoulder impingement injuries, generally, I find it has a lot to do with posture. If your posture is starting to, I'm going to just turn to the side. If your posture is starting to kind of drop down, this area where those muscles are supposed to go under starts to reduce the space, so they don't have enough space to move, so then they start to pinch. And then with repetitive pinching, eventually it causes a shoulder impingement, and sometimes it also causes a tear in that muscle. So that's typically what a shoulder impingement happens. A lot of times, patients will come in with a shoulder impingement. They'll do some rehab. It feels good. Their pain goes down. Then they go back to regular life, and then the pain comes back. That's because a lot of times they haven't really fixed the main issue that's causing the impingement, and that's your posture. If we can correct your posture, you should have a reduction in your impingement, and that's probably the long-term goal. Your short-term goal, obviously, with rehab is to get rid of the pain, because most people are suffering with the pain. But once your pain is down, it doesn't go away. You have to take your time to get the strength back, and you have to take the time to correct the position of the shoulder blade. Like I was saying in the beginning, there's almost 18 to 20 muscles attached to the shoulder. So, if certain muscles are tight, they're going to pull it in a certain way, and sometimes that can cause that impingement. Okay, and then as well as your posture. So we'll talk about that when we're doing some of the exercises. Okay. Another common injury, arthritis. I'm sure you guys have heard of arthritis. It's not just for the shoulder. People get arthritis in their knees, back. So what arthritis is basically that's when the cartilage between two bones, they start to kind of reduce. What the cartilage is basically a cushioning in between. So for example, for your shoulder, you have this cartilage between this bone and your shoulder blade. And that cushion that cartilage just gives the cushion between the two bones so that they're not grinding against each other. With time, if you're repetitively using the joint, maybe for work or sometimes even with posture, if you're putting too much load on the joint, that cartilage starts to get thin. And at one point, it gets to a point where sometimes a bone is rubbing on the bone, and then you start getting inflammation. So when they say you have arthritis, the itis at the end of the term, that means inflammation. So you have an inflammation of the joint. A couple things about arthritis or osteoarthritis. There's naturally we do lose some cartilage in our joints. It's normal with age and with wear and tear. So when you go to your doctor and they say you have some mild arthritis, that's nothing to be alarmed of. With age, you do start to develop a little bit of degeneration. That's the term that they use. But sometimes you might start developing it a little earlier. That might be because of repetitive use. So there's no cure to osteoarthritis, like arthritis specifically. You can't bring the joint back. There's some new research coming out where they're doing like PRP injections, where they inject your joints with your own cells to try to develop growth in the joint. It's still new research. It's not covered under OHIP, but it looks promising. But generally speaking, for arthritis, your main goal is to try to prevent it from getting worse, basically, from you reducing or making the joint thinner. And the best way to kind of prevent something like that is through exercises. Maintaining some exercises, maintaining good posture, and not putting too much load on that joint. Okay, so again, we'll go through the exercises at the end. Another common injury, frozen shoulder. I'm sure a lot of you have heard of frozen shoulder as well. So what happens with frozen shoulder, basically there's 3 phases to frozen shoulder. There's the freezing stage. So what happens is inside your joint, you start to develop a little bit of inflammation. That's the freezing stage. That's where you get a lot of pain. The second stage is the frozen stage. That's when your joint starts to get stiff. So after you develop inflammation inside the joint, that inflammation starts to turn into a bit of scar tissue, then it stiffens up. At that moment, your joint basically locks, it stiffens up. And then your last stage of frozen shoulder is the thawing stage. In that, you gradually get your movement back. Now, the issue with frozen shoulder is it's a very long-term injury. Naturally, it can take anywhere between 1 to 3 years for your actual shoulder to come out of a frozen shoulder. So that initial phase I was saying, the freezing, where it's just inflammation in your joint, that sometimes can be anywhere between 1 to 5 months, 1 to 6 months. Then after that, when it stiffens up, when the joint stiffens up, that can sometimes take up to a year. You'll have reduced range of motion. You won't be able to move the shoulder. A lot of times with frozen shoulder, the 3 movements that get reduced is going upwards, frontwards, and then trying to pull outwards. So when I see frozen shoulder patients, like this is how your movement should be, they can't get past here. It basically gets stuck. And when I try to push it up, it's like locked. So what causes frozen shoulder? Majority of the consensus right now is that we don't know. It's an insidious injury, so they don't know what the cause of frozen shoulder is. They do know that diabetic patients are at a higher risk of frozen shoulder. So I think they say 30 to 40% risk factor if you're diabetic in developing frozen shoulder. I find frozen shoulder typically happens secondary to a previous injury. So say you have a rotator cuff injury. Sometimes with that rotator cuff injury, you start developing inflammation. The inflammation goes into the joint, and then once the joint gets inflamed, it starts to stiffen up, and then you get into that, that frozen shoulder. The shoulder starts to lock up. But again, they don't know what's the initial cause of frozen shoulder, but more likely, from my experience, most patients come in with a previous injury, something's irritating it, and then the joint starts to get inflamed, and then that's when they develop frozen shoulder. With rehab, we can speed up the process of the recovery. Like I was saying, sometimes frozen shoulder can take anywhere from 2 to 3 years to fully recover. Sometimes with rehab, physio, and chiro, we're just trying to get that shoulder moving. So, continuously coming in, maybe once a week, we'll try to achieve getting the movement much faster. But even then, I can say a lot of times my frozen shoulder patients can take anywhere between 6 months to a year to fully recover. So you can you can cut off that recovery up to half. Those are some of the common shoulder injuries. In terms of some of the common questions I get with shoulders, a lot of times when patients are having shoulder pain, they start to develop a click. They say, anytime I move my shoulder, I hear this click in my shoulder. I hear this clunk. Typically, what happens with that click is, like I was saying before. So once you start developing an injury in the shoulder, a lot of times certain muscles start to get weak. Other muscles start to overwork. What that causes is the shoulder blade to kind of move into the wrong position. When that's in the wrong position, then your rotator cuff is actually basically clicking against the bone. That's typically what causes a click. So anytime you move your shoulder, you'll feel like, oh man, it's clicking. If you notice a click in your shoulder, what I try to tell patients to do is try to fix your posture, try to squeeze your shoulder blades back, and then try to move your shoulder. You might notice a less click. That's because you're putting the shoulder blades, you're forcing the shoulder blade to be in the proper posture, the proper position. Once it's in the proper position, that rotator cuff will actually glide freely and you won't hear a click. So, again, right now with working from home and, a lot of the stuff we're doing, we're always kind of in front. You guys are using your phones in this position, so the posture is always slightly dropping. You'll notice your kids these days, lots of video games, they're always sitting hunched. When they're studying, they're sitting like this. Just remember to tell your kids to try to sit straight up. My rule of thumb is you should get them a chair that kind of goes up to your shoulders and just tell them to make sure their shoulder blades are touching the seat. Okay, that's how you know you're in a good position. Once the shoulder blades drop off, you've lost your posture. Okay, and then a lot of times that upper back area is where it curves up, and then you start getting some impingement or shoulder issues. So, you got to be really careful when even for everyone working from home right now, if you've got a desk job, make sure your desk or your computer is kind of like right in front of you. Keep your elbows close to your body. Don't have them reaching out like this. This can cause an impingement. Try to keep yourself straight. Try to keep your shoulders straight. Try to keep your head aligned. Let me just sit sideways so you guys can see. So you want to try to keep those shoulder blades touching your chair. You want to be in this position. You know, you don't want your computer too far out. You're going to start to lose the posture. You don't want your head too far out. You'll start having neck pain. So, you know, try to keep yourself straight when you're working. This is going to feel weird because we're not used to it, but this is actually normal. You know, even for me, sometimes I have to be reminded when I'm working, when I'm seeing patients, I'm always in this position. So I always try to do some exercises at home to maintain, you know, good posture. Okay, so I think we can start going through some of the exercises. 1 second, actually. Can you still hear me through the mask? Yeah, okay. Do you mind coming standing up as a demonstrator? Here, I'll just get you to stand over here. Okay. So, you know, when I have shoulder patient injuries, the first thing I'm looking for is how their posture is. Right now, I think he's forcefully keeping himself straight. I'm just joking. He's got pretty good posture. So, you know, a lot of times when patients, like for example, if this shoulder is injured, I notice that they tend to be kind of in this position, okay? So when they come in, they're slightly slouched down, they're rolled forward, and then that's why, you know, a lot of times patients are getting impingement issues here, they're getting rotator cuff injuries. So the first goal is to try to correct that, try to get them back in this position, okay? So, you know, the best way to so when you start to have a bad posture, when you're in this position, what happens is these muscles back here, they start to get weak, okay? So they're not functioning anymore. When these muscles are functioning, they're pulling you back, okay? So the back muscles get weak, and then these front muscles, they start to get tight, okay? So how to correct this? You want to stretch the front, and you want to strengthen the back, okay? So a really good exercise for kind of stretching the front is, here, I'll just get you to come here. You want to try to grab your arm and you want to try to pull it back and try to stretch that front area. So here, give it a try. So your arm up and then rotate your back this way. And then, do you feel a bit of a stretch here? Yeah. So, you know, like I was saying, this gets really tight. If you can start to stretch that out, your shoulder blade will start to kind of come back a little bit, okay? So I typically tell patients, you know, hold this for about 15, 20 seconds. You know, that's a good stretch. If you start to feel pain, obviously you can stop. You know, hold it for less, hold it for 5, 10 seconds. And then, you know, just go to the other side to give it a break. Then you can do this side and pull this way. Okay. Another one, am I on the camera? I'm good? Yeah, okay. Either way, I just have it down here because there's no space here. But yeah, what I typically do is usually I tell patients, you know, start down here, okay? And then, you know, when you've held it for like 5, 10 seconds here, you can always move it up a little bit. You're going to start to feel it into different areas then. You might feel a little lower, a little higher. So, you know, muscles have multiple fibers. So you want to work on all the fibers. So by moving into different areas, you'll start to find, you know, other areas that are, you know, starting to stretch.
How far it can go?
You know, most patients can kind of go up to here. You might start to feel a pinch, so I don't like to go too high. I want to keep it a little lower. You know, if you're coming in with a shoulder injury, sometimes doing this is very painful. So I don't even get patients to start with that. What I sometimes get them to do is, if you lie down here, will you be okay? Yeah. So here, I'll show you. Sometimes I get patients to kind of lie down in this position, this arm out, and then I get them to kind of stretch this way. Okay, so you achieve the same movement in here. Okay. So yeah, you want to try to kind of stretch that out. To kind of strengthen the back, I find resistant bands work. My apologies, I forgot to bring a resistant band with me. I was supposed to bring it. I was going to show you guys, but I'm sorry? Yeah, it's like an elastic band. Unfortunately, I don't have one. You have one? Okay, perfect. Okay, he's going to bring it. All right. Oh, okay, yeah, come over here. This way. So in the meantime, while he's bringing that, another good stretch to kind of open this up is, I don't have a corner here, but if you go into a corner of your room, so if the corner of the wall is here, I typically take my arms and I try to pull my body in towards the corner of the room, okay? So that also kind of helps to open up. You're basically got both arms in, and you're just trying to squeeze that together, okay? Perfect, thank you. So, you know, right now with COVID, you know, a lot of people are not attending gyms either. So I find just buying like small little things like this can help a lot at home. with certain exercises that you're doing. You can do a lot with resistance bands. You know, I'll talk to these guys. Maybe I can even do just a session where I'm doing some resistance band exercises for like the legs, the shoulders. I can show you guys some cool stuff with this. But okay, so what you want to do in terms of strengthening the back, you want to try to use resistance bands to kind of bring those shoulder blades back. So one good exercise, you basically tie the resistance band around your hands, okay? You have it in front of you. You squeeze your shoulder blades in the right position, and then you just try to pull back, okay? You're gonna feel it kind of pulling in that area. And what you're pretending to do is you have a pencil between your shoulder blades, and you're just trying to squeeze that together and hold it. Okay, here, you can try it. There you go, okay? So you feel that squeezing in the middle, right? So that's a great exercise to try to bring those shoulder blades back together, help your posture. Look at this, and it's, you know, you can get this for like, you know, $5, and it does such a.
Sitting in the chair as well.
You could do this sitting on the chair. There's other things you can do with the bands in terms of, okay, so that's one exercise. Another exercise, here, okay, you stand here for a second. Pretend like if you have a staircase rail, so I'll just get you to hold in the middle, just in the middle. If you have a staircase rail that you can wrap this around, you can work on, here, just bring this up a little bit. Yeah. You can, so pretend that's a staircase rail. You're squeezing your shoulder blades and you're just trying to pull this back this way. Okay? So these are called rows, okay? So you basically are trying to bring it together in this position. So here, we're gonna flip and you're gonna try this. Same thing, before you're starting, make sure you squeeze your shoulder blades together when you're doing it. Yeah, and then pull back, yeah. Okay, that's good.
Wow, it's very effective.
Yeah, for sure. Okay, so those are generally posture, you can sit down, thanks, Jazakallah. Those are generally posture exercises that I find are very helpful in terms of correcting your posture for long term, so you don't, to prevent shoulder injuries. But you know, typically when I have patients coming in, they're in a lot of pain. They can't even do those exercises. They're not even ready to do any resistant exercises. So what generally happens for me is when I see patients like that, my initial goal is to get their movement back. Okay, so we got to work on range of motion exercises first. So, you know, when I have patients coming in, I'll tell them to raise their arm. They can maybe go up to here. They can maybe go up to here. They can never get it up. Going backwards is probably one of the hardest movements to get back when you have a shoulder injury, okay? So generally, you should be able to kind of touch right between the shoulder blades. A lot of times, most patients, when they have an injury, they can maybe even possibly get up to here. So my initial goal is to get their movement back. So the best exercise is to try to get your movement back. The first one is pendulum. This is one of the easiest exercises. Every surgeon gives it, even after surgery. You get into this position, you lean, you let gravity pull your arm down, and then you just do some rotations, okay? You've done this before, yeah. So in this position, what you're doing is you're letting the shoulder gap a little bit, and you're trying to get some fluid back into the joint, right? Yeah, all your weight is down on this, but you're letting gravity just drop this down. I don't want you to force the movement. You do small little circles, and you just try to get, you know, 20 clockwise, 20 counterclockwise. Just get some good movement back into the shoulder. It literally circulates the shoulder really well.
And should be in position or like this position or this?
Any position. I find like if you just drop your fingers down, you're just letting it go. When you're trying to hold it up, you're still activating some muscles. I don't want any muscles activated. I just want it like drop dead kind of thing, like feel like it's not even there, and you want to get good movements. Sometimes I also tell patients, you know, if you have like just like a bottle of water, you can even hold that a little bit, and it lets it pull down a little bit more, and then you can get a nice rotation in there. So that's basically the first exercise that you will have in terms of range of motion. The other exercises I find sticks. They're really good for working on range of motion. So for example, when I get a patient and I tell them to go forward, raise your arm up, most of the time when they get up to here, they start feeling pain. So when you're raising your arm up, you're activating your muscles. And if that muscle is injured, it's gonna hurt. So you wanna try to get that movement back without activating the muscles. So one good way is, if you have a stick, again, you pretend like this is dead weight, you're not moving it, and you use your good hand to push it up. So you kind of get into this position, you're literally just trying to push that shoulder up, okay? So again, if you do this right, you shouldn't feel too much pain, because in this position, all your movement is coming from this. These muscles are not firing. They're not moving at all, okay? So pretend like it's dead weight. You can't move it at all, and you just let your good hand push it up, okay? So in this, like you can work on any range of motion. You can basically go sideways, you can go forward, you can hold it in this position and try to rotate it outwards. You can even go this way. So there's all kinds of movements you can do. You can even kind of go backwards, okay? So I find sticks are great when you're in pain. It's one of the best, equipment to use to try to get your movement back. Once you start getting some easier movement back in the shoulder, then you can start doing some wall crawls. So, use the wall as a good way to try to get that shoulder up. Again, you're using your good hand for assistance, but if you are getting comfortable with it, you're gonna notice that you might not need your hand anymore, and then you can start to kind of go up as far as you can. So they call this wall crawl. So you can do it from the front, you can do it from the side, and you try to get that up. Yeah, spider crawls, yeah. Okay, so those are some of the good range of motion. Now, the most challenging range of motion to get back for me clinically for patients is going behind their back. Sometimes I have patients, their injury is recovered, their pain has reduced, but they still can't get their arm back. Sometimes it's chronic, like patients never get their movement back. But I find like if you can start early enough, you should be able to get some of that movement back. So one of the best ways to work on it is using a towel. So basically, with your good hand, you pull the towel back, okay? And then your bad hand, or your injured hand, you grab it and you don't want to force it because you might hurt it, but you just want to slowly start working to try to get it up. Okay? And then, we always say only go up to where you have no pain. Once you start to have pain, that's all you can tolerate right now. But don't worry, the more you practice it, the more movement you will eventually get back, inshallah. So you just got to you got to take your time, because these shoulder injuries generally, I'm looking at anywhere between 2 to 6 months of recovery. So, don't force it, don't rush it, give it its time, let it heal. So, take your time when you're doing it. So, again, I'll just kind of show you. You want to try to get it up. Good. And then you just slowly bring it back down. Okay, so that's a really good way to try to get a little bit of that movement back. Okay, so, I find when I have an acute injury, a patient with a shoulder injury, it can take probably about, I would say anywhere between 2 to 4 weeks to get their full movement back. Once their full movement is back, then we can start focusing on strengthening. You don't want to start strengthening too early. The reason why, like for example, say you don't have this movement back, you don't want to start strengthening that because, like I said, there's so many muscles attached to that shoulder blade. If you don't have that full movement, you might be using other muscles around there to get that arm up. Sometimes you can cause more damage with that, right? So most therapists agree that, once to start working on a little bit of the strengthening more once you have better movement or you'll have almost full range, okay? With the exception of maybe this one, this might take a little longer, but once you have full range going upwards, you can start working on some of the strengthening. So in terms of strengthening exercises, there's a few things you can do. So again, you gotta work on which movements are weak, okay? So when a patient comes in, for example, they're not able to get their arm up, or they feel weak when they're getting their arm up, that's the one we're gonna work on. So again, resistant bands are great. So if you go on Amazon, Winners, Walmart, wherever, buy some resistant bands. They're great for home. You can always do some easy exercises when you're even sitting there. So what I typically do, just step on the band, roll it around a little bit to get a little bit of resistance, and you basically just pull up. Okay. So that's kind of going frontwards, okay? If you're lacking sideways, you pull up sideways. You always gotta remember to keep that shoulder blade in the right position when you're doing this, okay? You don't wanna be down here, because when you get into this position, again, you're gonna pinch it. So, always bring those shoulder blades back up and work on trying to pull. Frontwards, sideways, okay? And then you can also work on trying to, they call this the sword exercise. You have a sword and you're gonna try to pull it out. Okay, so that's another good exercise. Okay, some patients might have issues kind of going outwards. So what I typically do for that, I tie the band to a doorknob. So pretend this is a doorknob, and you're standing in this position, and you basically pull out this way. Okay, so I'll do it sideways as well. You pull out this way. And you're basically strengthening back here. Yeah, so that's a good comment. So he's correct. So you should always put a towel in between your arm when you're doing that exercise. The reason why, and I'll tell you, so in this position, you just pull out. The reason why is because to get the muscle that's injured, your rotator cuff muscle, if you want to actually activate or engage or strengthen that, you have to have that elbow in. Once you start pulling out, you start activating other muscles like your deltoid. So you're not actually really strengthening that muscle. So, for rehab patients, you always want to keep the towel there. Eventually, when you get used to it, you'll remember to keep that elbow there. But when you start, always have that towel there. So thank you for that. That's a good comment. So this is a good way to strengthen outwards. If you want to bring the resistant band inwards, so you got to get someone to hold it here, and then you tie it around the doorknob, and then you try to bring it in this way. Okay, so the one I just did was going outwards. If you want to go inwards, you start over here, elbow tucked in, and you try to pull inwards. Okay? Yeah, so, yeah. Sorry?
The band strength is dependent upon the feather, right?
Yeah, so this is a yellow band. I believe the yellow one is the lightest one. So this is probably like about 1 pound of resistance. Now, I find like, if you roll it enough, you can probably get a little bit more strength. But they do have different color bands. Like I think a lot of times when you buy them, they have like 3-4 colors that it comes in. So they'll give you like the lightest one, medium, high. I always tell patients start with the lightest, especially when you have an injury. Of course, if you don't have an injury, you could probably use a slightly heavier band. But if you have an injury, you got to be really careful with what band you're using. You don't want to obviously aggravate it. In terms of some people use dumbbells when they're trying to rehab strength. That's fine too. Dumbbells are as effective. I find with the resistant band, the only difference is, so basically when you pull up, it's resisting you, right? So that's what a resistant band is. So the higher you pull up, the more resistance you're getting. So you're actually getting a lot more, I find, strength or endurance with a resistant band than just grabbing a dumbbell and lifting it. Okay, with the dumbbell, your only resistance you're getting is the weight and gravity pulling it down. Whereas with the resistant band, the more you pull, you get further tightening. And then if you roll it in more, the more you pull, you'll get a little bit more. So when you get up here, you could possibly be, like this is a 1 pound band, you could possibly be lifting 5 pounds by the end of it, right? So I find for endurance purposes, this is probably the most effective. But you can use both. I think both are, totally fine. But these are, very cheap to get. With COVID right now, dumbbells prices have skyrocketed. So you might be better off getting the resistant bands for rehab purposes. Yeah. Other questions I get, should I ice it? Should I heat it? We talked about this with the knee. I think some of you guys were here for the knee session as well. But okay, so my rule of thumb is if you just have a brand new injury, you just recently injured it, that first 7 to 10 days are the most crucial time to ice it. The reason why is a lot of times in that first week to 10 days, you have inflammation in there. So you have to get rid of that inflammation quickly. If you don't, sometimes that turns into scar tissue, and then your recovery becomes much longer. So my rule of thumb is always ice it if it's a brand new injury. That first week to 10 days, the best thing to do is ice it. You'll see pitchers if you watch baseball. Once they're done pitching, they're in the dugout on the bench, and they have a big wad of ice on their shoulder. The reason for that is they want to prevent any inflammation because they got to pitch in another 3 days, right? So these athletes, they have to be ready for the next game, so the first thing they do is ice it. So my rule of thumb is just ice it that first week. If you have a long-term injury, a chronic injury, if you have arthritis, I find heat is more effective. Heat tends to bring blood flow to the area, and that can loosen the area out. It can loosen your joint out, it bring blood flow to the joint. So I find heat is more effective. I'm sorry? Oh, cream, yeah. I find creams are great. They give you that temporary relief. They don't fix the issue, but BioFreeze Voltaren, those two are very common. Sometimes your doctor will prescribe you something stronger, like I think it's called Flexeril or diclofenac. I find those. Oh, once you apply the cream? It depends on the brand. I find like the BioFreeze gives you a bit of a cold sensation, like a minty feeling, yeah. Whereas Voltaren, I think I don't feel that cold sensation, but all these creams, their main purpose is to reduce the pain that you're feeling, sometimes distract the pain by giving that burning sensation, and try to get rid of some inflammation. So I'm probably on the side that possibly they're more for cold purposes to try to get rid of the inflammation, because that's what ice does as well. But yeah, they're like, if you're dealing with pain, sometimes just using the cream really helps. When I have patients that come in, sometimes I put BioFreeze on it and then I try to stretch them out. So I'm like applying the cream, it's giving me some, less friction, so it's not burning the skin. And most of the time patients feel good once the cream is on. But
Can we say for muscles it is cold pack and for joints it is hot?
No, because even so, in terms of how the injury phase works. So, say you injure a muscle, right? So that first week, you're just in a lot of pain. When your body is feeling pain, its defense mechanism is to tighten up. Okay, so that first week you have inflammation and your muscles starting to tighten up. I find in that first week you still got to ice it because you got to get rid of the inflammation first, right? Once the inflammation is gone, then you want to heat the muscle, because I find with heat it loosens the muscle out, right? So, your first week you're going to be having a lot of pain. Then your next, 2 to 6 weeks is just a lot of tension you're feeling. Like it feels stiff, it feels tight. When your body is healing it, if it tightens up, it stiffens up. So I find heat is actually more better. So I would say, you can ice and heat for both joints and muscles depending on which stage you're at. So, even joints, sometimes the joint can get inflamed. You might have like an acute, like an early arthritis. Sometimes ice is better for that. If you're feeling a lot of pain, ice can sometimes be much more effective in reducing the pain, getting rid of that arthritis, like the inflammation in the arthritis. And then later on, like if you're still having ongoing stiffness, then heat is more effective. Yeah.
In a situation where particular muscle needs the heat,
Yeah.
but we, being a layman, just put ice.
Yeah.
Will it aggravate it, or will it just?
No, not necessarily. If it might tighten it more. Sometimes, like in winter, you guys, a lot of people feel really stiff. So like if a muscle is tight and you put ice on it, it might stiffen up a little bit more, but it won't cause more of an issue. No, once the ice is off, your body will start to warm up again gradually. So then, it won't. I don't think it will harm you in any way. No, but. In that first week when you have an injury, sometimes if you add heat rather than ice, because with heat you're bringing more blood flow, you can possibly bring more inflammation into the area. So sometimes that might be counterproductive. It might cause more pain for you. So that's why that first week is always very important to ice it first, because at that moment, I have patients, they'll be like, I put heat on and it felt good at the moment, but like, an hour later, the pain was even worse, right? So when I hear that, then I usually tell them, you might have possibly brought a little bit more inflammation to the area. So then, once they switch to ice, it's helpful, yeah.
Exercise typically get, kind of stiffness in the muscle.
Yeah.
So we take hot water bath, right?
Yeah.
Is it good to take hot water, or is it good to take cold water bath? Because as you said, ice is the way to go.
Yeah. So after, like if you work out, right, and right after your workout, if you're starting to feel a little sore, like if those muscles are feeling sore, I would probably ice it first. Yeah. The next day, you might wake up still feeling a little stiff. You can put some heat on by then, right? In terms of rehab purposes, so say they're, say I've been seeing the patient for about a month now, right? So they're past that acute stage of their pain. When I tell them to do exercises at home, what I tell them is, say they don't have full movement yet, so their muscles are still tight. What I tell them is first put some heat on for 10 minutes, let it warm up, or go for a walk. Walk and move your arms, and get some blood flow to the area. Once you have blood flow, then do your exercises. Work on the strengthening. Once you've done all your exercises, apply some ice on it. Okay, because sometimes with the exercises, you might irritate it a little bit. So then you apply ice at the end just to kind of numb it down and get rid of inflammation if there was any there. So that's basically my plan when I have a patient, they've been there for almost 4 weeks, 6 weeks, they're just doing their exercises. Start with heat, warm it up first, do your exercises. Once you've done the exercises, ice it for 10 minutes. And then, that's basically your plan, yeah. Very good question. I'm not a surgeon, but from what I've seen clinically, a lot of times when patients have rotator cuff tears, it's a partial tear, so there's minor tears. It's not a full-blown tear. Most surgeons will not do surgery on that. That's basically the rule of thumb now. Again, I'm not a surgeon, but I don't want to speak for them. They're going to get upset at me if I give advice. But surgeons typically, they prefer, like if you have a partial tear, to try to do some rehab first. They'll tell you, go do some physio, start working on some exercises because, your body still can heal. It might not completely heal, but, with a partial tear, you can get almost, full healing in those partial tears. If you have a full-blown tear, if the whole muscle is torn off, rehab won't fix that. You have to more likely have to do surgery. But it also depends on, I think, age. So, sometimes, and again, I'm not a surgeon, but, from what I've seen with patients, I do have some patients, in older ages, 60, 70, they have a full-out tear, and the surgeon will not do surgery on it. They'll just say, because of your age, we're not going to do surgery. You're just going to have to manage it with what you have. So partial tears, minor tears, no surgery most of the time. Rehab is pretty effective with it. I actually tore my rotator cuff as well when I was in school. Again, it was a partial tear. I did rehab. It took me about 2 to 3 months, full recovery. Didn't require surgery. Yeah. MRI is gold standard. So MRI is probably the best image for almost any region. You can see your nerves in detail. You can see your muscles, tendons. The only problem with MRI is here in Canada, well, especially in Ontario, it's very backlogged. So if you were to go to your doctor right now and say, I need an MRI for my shoulder, you could be waiting anywhere between 4 to 6 months to get your MRI. So if you want a quick image, ultrasound is much better. So ultrasound will show you the soft tissue. At least it can give you you can get an appointment within a week. And at least we can, you can immediately see if there is a possible tear. But sometimes with ultrasound, it's not the best image, so it might miss some things. But it's a good early image to get just in case. I have patients that do ultrasounds all the time, and they'll say that you have a partial tear. So, it's still pretty effective. But if you're looking for something quick, ultrasound is. Most of the time when I have a new shoulder injury patient and I'm suspecting that maybe it's torn or something is off, I usually tell patients, go see your family doctor and see if they're okay to refer you for an ultrasound. Because I know if I tell them to go see your doctor, get an MRI, they're waiting 6 months, and I'd rather get something faster just to see what's going on.
Does OHIP cover chiropractor?
No, unfortunately not. I think physio too, there's certain clinics that are covered under OHIP, but a majority of clinics are private. So, chiros, physios, massage therapy is not usually covered.
65 and under?
Oh, maybe, okay, yeah. Yeah, so maybe 65 over, you might have some coverage with physio, but chiropractic is not covered under OHIP at any age, so. All right, anyone else have any questions? Oh, yeah. 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 Okay, that's a very good question. So, the brother asked, when you sleep on your side, sometimes you wake up feeling a lot of pain. Yeah, a lot of times, for example, if you're sleeping on your right side, you might cause an impingement. You might, because you're sleeping in that position for almost 7-8 hours. You could put it in a position where the muscle is getting pinched. So, I usually tell patients, I like sleeping on my side. I try to alternate. I don't sleep on one side all the time because sometimes you can also tighten your neck on that one side. So say one day I slept on my right side. The next day I'll just sleep straight. The following day I'll sleep on the other side. I'll try to change it around. There's less risk of you impinging it. In terms of position, I try to keep, if I'm even sleeping on this right side, I do keep my arm up, but I don't get it up here. Okay, so don't put your arm under your pillow. you're actually possibly impinging it, you're pinching it, okay? Try to keep your arm down, try to sleep in this position. And even this arm, like you don't try to bring, like if you're sleeping on your right side, don't bring this over. Try to keep it beside you here, okay? So, anytime you get this above here, you're at risk of causing a pinch in the shoulder. The best position to sleep will probably be on your straight, but some people, even with sleep apnea, you can't sleep on your back. So, you sometimes have to sleep on your sides, and that's fine. Just make sure you don't keep that shoulder up. If you sleep on your right side and you put a pillow there, yeah, that's fine as long as it doesn't go up here. Right? So if you keep it down here, you can, you don't even have to have your hand up. I like to keep my hand up. I don't know why, but it's just probably habit. But, if you keep it side down here and just your head's on the pillow, that's probably better, right? As long as it doesn't get up, you're not going to pinch it. If you keep it down here, it's okay. It's kind of like the posture I was talking about when you're working, right? You always want to keep your elbows beside your body. You don't want it out. You don't want it up because you could be causing damage to the shoulder. Keep it beside you. Anything beside your body is always good. Elbows beside your body. Yeah.
This positioning when sitting and doing some work,
Yeah.
most of the tables are like this, right?
Yeah.
Even the keypad tray
Yeah.
is like this.
Yeah.
How do one go like this? Because this is the most optimum.
Yeah. You try your best. Try to bring your chair in. Try to move your keyboard closer to you if you can. Even if you pull the keyboard out, try to roll your chair in closer so you don't have to reach. Sometimes there could be limitations. Sometimes even at work, they don't have proper workstations. I usually tell patients, ask your managers if they can provide like an ergonomic assessment, right? Sometimes they'll have an occupational therapist come and see where your workstation is, try to fix that. Laptops are the hardest, right? Because there's no keyboard, right? So you have to be kind of slightly in this position with the keyboard. The mouse is over here, the trackpad, and they're not. I actually tell patients, for that purpose, try to get an external keyboard, attach it to the laptop, keep it over here. Even for laptops, like they're low, so you have to look down. I tell them get a monitor. Dock your laptop, put it on a monitor, bring your keyboard closer. It'll save a lot of issues. I have patients that, they've always been looking in this position. They have so much neck pain, headaches. This is all because of poor posture. Standing desks I find are very effective, but research shows standing all day is not effective either. You should always alternate. So, an hour sitting, an hour stand up. Your standing desk, again, should be about here, okay? You don't want it too high up, okay? So if you can elevate the desk up to here, this is a good position. Keep your keyboard up. Sometimes you might need to prop up your monitor so your head's straight, so you don't want to look down. So yeah, but standing desks are great. I find they stand you up. You get circulation in your legs. I have patients that get sciatica because they're just sitting all day, right? You're putting pressure. Your sciatic nerve goes at the back of your glute area and down the leg. So if you're sitting on that nerve all day for 7-8 hours and work is always busy, you can start developing sciatic issues. So it's better to get a standing desk, move around. Even if you can't get a standing desk, that's fine. Every half an hour, 45 minutes, always try to get up, move around for 5 minutes. I know work is work, but your health is important as well. So get up every half an hour, 45 minutes, move around, go for a quick walk, grab some water. Move around a little bit. Don't stay in that stationary position for too long. Long drive, same thing. If you're going for a road trip, 3-4 hours, you should try to get out every hour and just, move around a little bit, stretch, and then get back in the car. Yeah. Yeah, no, I always recommend a pillow, only because. Oh, you have a question? Okay. Oh, sorry. Yeah. In terms of pillow, I will always recommend a pillow because if you don't have a pillow, your head's dropping. You never sleep with a pillow? No neck pain? Alhamdulillah, that's good, man. Yeah. Yeah. No. Well, you know what? Sometimes your body can adapt, right? So. Yeah. Hold on. Okay. Question?
I have completed my 70 years.
Alhamdulillah. Yeah. Okay.
But in my lifetime, I have not gone to any doctor.
Mm-hmm.
In Canada, I am 19 years.
Okay.
But I have not gone.
Mm-hmm.
But last 15 days,
Okay.
I have taken Advil,
Okay.
and I hope it is very good. Advil is very good for me.
Mm-hmm.
Whenever I feel pain in my body also.
Mm-hmm.
So when I go to the doctor today,
Yeah.
I want to go for X-ray. I don't want to take any medicine.
Mm-hmm.
So they take an X-ray.
Yeah.
Now my result will become after 2-3 days.
Okay.
But they had given me this tablet to take.
Okay.
30
Okay.
tablet they
Okay.
have given.
Okay.
So I will start this tablet.
Okay.
But I'm feeling very good now.
Okay.
I don't feel some bad.
Yeah.
But I start this tablet.
Yeah.
So what do you think, this is good?
Well, so recommending medication is out of my scope of practice, so I can't actually even advise you in terms of medication. But you can talk to your doctor. Call like when he goes through your results again, tell him that my pain's gone down. Do you think I should continue taking this medication? Yeah, one time I had knee surgery. They gave me 90 days supply of medication, strong pain medications. After 3 weeks, my pain reduced significantly. I didn't need to take the pain medication anymore. So personally, I stopped taking it. But it's totally up to you. You probably should ask your family doctor before. But if I tell you something, that I can't tell you that.
What about you think, 10,000 vitamin D, is good or not?
Supplements are always great. Vitamin D is good for bone health, calcium. For joints, I find glucosamine is a good supplement to maintain joints. Again, research is mixed. Some research has shown that you can take glucosamine for a long time. It doesn't really prevent that wear and tear, the arthritis that I was talking about, that you naturally will develop anyways.
What about physiotherapy? It's good to take or not?
Absolutely, yeah.
It is free for after 65.
Yeah, absolutely. Again, it's just going through some exercises, maintaining movement. Alhamdulillah, you're sitting, at age 70, you can sit fully on the floor. I have patients that, they're in their 30s, they can't sit on the floor, right? So, alhamdulillah, you have good movement. Maybe you just need some strengthening exercises that will help.
Walking every day 2 hours.
Yeah.
Last 50 years.
Yeah, okay, alhamdulillah, yeah. Yeah, for sure, no problem. And then, sorry, you had one more question? Yeah. Oh, yes. So generally speaking, I find memory foam pillows are good. The main purpose of a memory foam pillow is it's kind of like a styrofoam. So when you lie down on it, it kind of foams around your head. Typical feather pillows will just drop. So even after a week to 2 weeks use, you start to lose that cushioning. So your head starts to drop. I find memory foams last longer. There's all kinds of products. There's all kinds of companies releasing them. I find Obisform memory pillows are usually pretty good. I think at our clinic they sell Obisform memory pillows as well. They're slightly more expensive, but I find long-term they're much better for where your position is of your neck to prevent a lot of issues. I have a lot of patients that, they say, I wake up and I always have a headache. Once they change their pillow, their headaches reduce significantly. So, but I always recommend getting some form of memory foam pillow over just a general feather pillows. Yeah. All done? Perfect. Assalamu alaikum, everyone. Thank you for coming, and thanks for all the questions, and Jazakallah, and Jazakallah MNN for having me here today. And I hope I was able to answer some of your questions. Assalamu alaikum.